Hi, Brady Barrows here with the RRDI, and we're going to hopefully do a series of videos on different subjects. The subject today is prescription treatments for rosacea, which have been around a long time. And we're going to discuss some of the state of the art rosacea treatments. Probably one of the oldest treatments for rosacea, it's been around for over 100 years at least, or longer, is using sulfur. And usually they treat rosacea sometimes systemically or orally and topically with sulfur. And some of the modern rosacea treatments that are still being used for rosacea are sulfur cream that's 5% in conjunction with sodium sulfositamide 10%. And some of the popular brands are Avar E Green, Plexion, Rosanil, Rosula, and these are still being prescribed for rosacea. About at least for 50 years or more, rosacea has been treated with antibiotics, in particular tetracycline. I remember in 1985 when I was diagnosed with rosacea, the dermatologist handed me a prescription for tetracycline. Well, later there are tetracycline drugs that are similar to tetracycline, like doxycycline and minocycline. These are derivatives of tetracycline. They are now the more popular treatment. In particular, one particular brand is Oratia. It's a doxycycline that's special, and I'll talk about it in a little bit. The other prescription that's been around a long time too, for over 40 years, is metronidazole. And usually this is a topical. It's either a gel or a cream. It's been around a long time, and it's still being used to prescribe treatment for rosacea. They have now, however, been giving oral metronidazole in some cases, and I'm going to talk about that too. Now, azilic acid began to be used about 20 years ago, and the popular brand name is Phoenicia, but there's now a generic azilic acid, and that's a popular prescription that rosacea is being treated with. More recently, in the last, say, less than 5 years, ivermectin is now being used to treat rosacea, and they've had tremendous success with one particular brand of topical ivermectin, 1%, Solantra, and it's very popular, and it's proved very effective in treating rosacea. Now then, sometimes oral ivermectin is being given systemically along with oral metronidazole, and there's a clinical paper on this that effectively treats rosacea, and but it's not real popular yet. Now, the most recent state-of-the-art prescription treatment for rosacea is a minocycline topical. They have a number of them in clinical trials, but one now has been approved. It's a foam. It's called Zilzi. And this one we're going to be hearing about without a doubt because it apparently is working really well. Now another treatment for rosacea that's very popular in the last 20 years or so is photodynamic therapy, which is laser, IPL, that's intense pulse light, and LED. These are all used to treat rosacea, and doctors are given these treatments, and they're very expensive usually, and you have to go back for more and repeated treatments. Now, when rosacea resists these standard therapies that have been given, sometimes dermatologists use off-label treatments for rosacea like Botox and other, there's a number of treatments, other types of antibiotics. And if you're interested in that, we have a whole post on that subject, when rosacea resists standard therapies. Now, do these work? Well, if they didn't work, there wouldn't be this tremendous amount of expense on these prescription treatments. One report said that the prescription treatments in 2019 amounted to $2 billion for rosacea. And what's interesting is 4 pharmaceutical companies have 75% of the share of that $2 billion, which is, the 4 are Pfizer, Teva, Foamix, and Bayer. If they didn't work, there wouldn't be tremendous interest and use of prescription treatments. They do work. Do they cure rosacea? No. Basically, what all these treatments do is treat the symptoms. They don't, because we don't know what the cause of rosacea is. But if you go to a dermatologist, it's keeping up. Probably what the dermatologist is gonna recommend is Oratia, which is a doxycycline, low dose. It's 40 milligrams. 30 milligrams is immediate release, and 10 milligrams is timed release in the gut. And it's low dose, and it really is effective for rosacea, along with a prescription topical of cilantro, which is ivermectin 1%. And usually this works, and it's been very effective. Some dermatologists may give you a prescription for Phoenicia, and if they're really keeping up, they're going to offer you Zilzi, which is a brand new myocycline topical. So maybe you'll get that. Old school dermatologists that aren't keeping up with what's the latest state-of-the-art treatment may hand you a prescription of 100 milligrams of doxycycline to take twice a day, along with a tube of topical metronidazole. And that's old school, and it may work for you. Generally, all of these prescription treatments, doesn't matter what, takes 2 to 3 months to get clearance, or at least where you can control your rosacea. Does it cure it? No. But it does work. And that's why most rosaceans, I would say the majority, go to dermatologists and take these prescription treatments. However, as you know, you got to keep going back, and you have to keep controlling your rosacea, because we don't know what the cure is. And that's why we formed the RRDI. We want a patient advocacy group to effectively give a voice for rosacea patients to the medical community. And that's why we're here. And we need to unite as rosaceans to have a voice to the medical community. And if we had a united front, we can influence what research is being done on rosacea. And we hope that this video has helped you to understand about prescription treatments. And look for, we're going to have some more videos on this, and hopefully you'll enjoy and learn more about rosacea. Thank you.